For this chapter, we'll continue to touch on emotional aspects that we may encounter. And this one specifically is with patients that were diagnosed with cancer. So, from the point of diagnosis and beyond, there's definitely some effects that can take place with the person, with their families, with basically everyone involved. And we certainly have a role interacting with this population in the care that we're providing. So I think it's a really important topic to delve into. The amount of persons affected by cancers is dramatically high. The textbook states 1 in 3 individuals will be directly affected. I attached, I think, a helpful presentation for you, a statistics-based presentation that really starts to, I think, better demonstrate trends based on male versus female, based on specific sites, based on different races and ethnicities. So I encourage you to dig into that, but that presentation suggests that 1 in 2 males will develop a cancer and 1 in 3 females will develop a cancer. So the amount of directly affected is high, but that also means the amount of indirectly affected is also high. So I'm sure that you've experienced a cancer diagnosis involving a loved one. It can be certainly a traumatic experience. For the person directly involved and indirectly involved. Very frightening, life-changing, a lot of emotional implications there. Just because it creates this unknown future. It creates changes in lifestyles for the person and their families. So there's acute issues and chronic issues, daily routine adjustments. So a whole bunch of factors kind of go into the diagnosis of cancer. Fortunately, improved screening, improved use of screening procedures has helped to improve survival rates. So the amount of individuals that have been diagnosed with cancer, while there's a lot, there's more and more that are surviving, which is great. Treatment techniques have evolved as well, and that's another reason for increased survival rates. But you have mammograms, you have breast MRs, you have breast sonography, you have CT colonoscopy, so low dose lung cancer screening. So lots and lots of screening procedures are taking place. The earlier you can find a cancer, the better. But regardless of how early it's found, it's still going to create all kinds of worries. And those worries will be dealt with in unique individual ways, and families are going to have to develop their own coping mechanisms as well. But very, very traumatic type of news that's delivered with a cancer diagnosis. And typically the way that it's delivered does have a lasting impact. From my experience in radiation therapy, you kind of hear about different ways that news is delivered. And, I think face-to-face is definitely the in my opinion, the appropriate mechanism to deliver this news. But I've heard stories about individuals being told that they were diagnosed with cancer over voicemails. I mean, it's just like, it blows my mind how patients are told at times, and that has a lasting impact about how they perceive that. So it's important to be there for our patients, to involve patients as much as possible, to support, to provide information. Any reaction to a cancer diagnosis is normal. There is no way to even describe what that reaction would look like, from a feeling of complete and utter rage to a feeling of complete numbness. However, whatever is felt, it's probably going to result in some type of change in character in the immediate, and perhaps even in the long term, until you come to terms with why this is happening. It's especially, I think, difficult for individuals that have lived quote-unquote healthy lifestyles to understand why this is happening to them, and when they're trying to do everything right. So there's a lot of emotional implications, but kind of along the way, from start to finish, of hearing the news and waiting for staging results and waiting to begin that treatment, and making treatment decisions, and that first treatment and every treatment all the way through the end of the treatment, and outcome results. And there's a lot of fear and emotion along the way, just because of the unsuredness and really in every step. So providing information to that patient directly, to the loved ones, to their supporting team, is a must. We have to be as transparent as possible, just so patients can start to regain some sense of control, or hopefully regain some sense of control. But nonetheless, to try to help with their emotional implications and try to be there and support as much as we can. I think the diagnosis of cancer is so unlike other pathologies that are diagnosed, because I think the term just has such a very, very devastating stigma associated with it, and creates a lot of emotional impact that is truly carried on to the complete care team, support team of that patient. So a lot of fear, anger, anxiety, guilt, loneliness are all emotions that can be stimulated. But how you tell a spouse or how you tell a child, I mean, it's going to be different depending, of course, on the age of that child and relationships that take place. But a lot of emotional barriers are there, and your support team will be there for you. But this diagnosis takes a toll on everyone. Can create depression and anxiety for the support team as well. So a lot of support services are required when dealing with the patient and their family and friends and loved ones. With cancer, the familiar burden can be quite high, especially for children. The effect itself will depend on the age of the child, from whether they're school age, high school age, or adult age. I think it's going to be different for each individual population, but these are some of the effects that could happen. But like I said, age will depend on the factors that are exhibited, but it's important to make sure that effective communication takes place between the patient and their children, between the patient and their families. So the more informed they are, the better their anxiety levels would be. So I hope it's clear that the diagnosis of cancer does not just affect the patient, it affects everyone around that patient, and it continues to grow as side effects from treatments are demonstrated, because that's just that constant reminder that there is something going on with this, going on inside of me or inside my loved one, and it's just that it creates this further lost sense of control. So one thing that I do want to point out, though, is that radiation therapy side effects and chemotherapy side effects are different. Radiation therapy is considered to have a local side effect. So say the patient is undergoing treatment for their prostate, the patient isn't going to lose the hair on their head for that. It's just local, so anywhere that the beam goes through may have some type of side effect that's generated, whether that be to the bowels, whether that be to the bladder for a prostate patient. Irregardless, it's just, if the beam goes through it, typically an effect may result. Chemotherapy is different because it's a systemic treatment. It's going completely through the body, so it's going to have systemic results. The only semi-systemic result of radiation therapy that's been reported out is fatigue. So just kind of keep that in mind. Radiation therapy is local effects. Chemotherapy is systemic effects. From our radiation therapists in the class, obviously that makes a lot of sense. You already know this type of thing. But for my other medical imaging professionals, this may be new information. Radiation therapy typically has two different intents. One may be curative, the other one may be palliative. So curative obviously is to rid the patient of that cancer, to preserve the quality of their life. Palliative is just simply symptom management. Typically it centers around pain relief for that patient. So the intents of radiation therapy may differ from patient to patient, and so the side effects may differ as well. And with palliative treatments, those side effects are relief of some of those pain symptoms. So it's not always a bad type of thing. But some definite positives of a cancer diagnosis that's cited by the textbook. It's kind of interesting to think of it like this: is that how the diagnosis of cancer can bring your families closer together, and also allows individuals to refocus their individual priorities. So kind of an interesting spin on things when you think about the positive aspects, just because there's so much negative that's associated with cancer, and helping and empowering those patients to get through. So we as practitioners definitely have a big role in helping with that process. So how we can help, there's quite a few different points here that demonstrate what we can do to help the patient through this experience. Communication is solid. It's really important. It's also important to assure the patient that what they're experiencing is normal. So asking the patients what's going on, what's happening, and then say that's normal, and it helps to alleviate some fears. But it's important to also involve every member of the patient support team in the process as well. So be as inviting as possible to the family members, because like as we demonstrated before, they're going through it as well. They're experiencing real emotions. It's taking a burden on everyone involved. So it's important to make sure that they understand and can help that patient reduce any form of isolation that they may feel, because their support staff isn't fully involved with every aspect that goes along. So another big important piece, and what I'm going to leave you with, is that when you're providing information, it has to be provided in a consistent and collaborative nature. So the information being provided from one person has to align with the information being provided from another person. So that mixed messages, information has to be minimized. So that's an important factor, and that goes along with the ideas that we've mentioned before with interprofessional communication. So I think in radiation therapy and in cancer care in general, I think interprofessional communication is the best in that arena, especially when you compare it to other areas, because you are working with nutrition, you are working with the insurance, you are working with the doctors, the nurses, the dosimetrists, the medical physicists. It's just a very collaborative type of environment, so it is a little bit different than some of the other things that medical imaging experiences. But I think there's a lot that you can learn from the radiation therapy perspective and model that can be applied to better improve medical imaging as well. So just a little bit of information to kind of grow on. Demonstrated here some things that we can work on. Understanding our role is important, because we have a very big one in helping patients get through this experience. So the time is now to make our patients aware that they have our support, and we become a little bit more patient-centered with our actions.